Okay, so we're back from last week and we're going to go ahead, or the other day. It's going to be a week for me when this comes out. And I've already picked our first letter. It's the letter S. So we're going to keep going with this vocabulary because this is stuff that you need to be totally familiar with when we talk about how to deal with injuries. So we're going to do some first aid stuff. So we're going to go to separation. Click. Okay, so pulling apart of a generally non-movable joint. So we can see the AC joint here. So AC, this is the clavicle. It's going to come out here to the acromion, so the acromioclavicular joint. That's what it's showing you. So we have the 3 grades or 3 degrees of injury, and the first one is going to be just a mild tear, this is a micro tear, and the second one is a moderate tear, and the third one is, man, we blasted right through that thing. I put a hula girl there for you to remind us that we gotta stay home all the time. Okay, so back. Next letter. Okay. Letter I. It's the letter I. Okay, so incision. Oh, this should be good. Okay, this is a cut made surgically with a sharp knife. So they're showing you a good little cut right there. They'll do it with the scalpel generally, but there you go. Different areas you could cut the body, I guess. All right, next one. It's the letter N. Okay, N. N. Oh, there's no N, so we're just gonna go to the next. We'll go to palpation. So palpation just means to touch. So if someone says, are you feeling tenderness or pain? So in that bottom left picture, maybe they're palpating the different quadrants of the abdomen to see where the pain is located. So that would be palpation. So you got to touch the patient. Okay, next. Hope you guys are good. It's the letter E. So we're going to go to ecchymosis. Ecchymosis. So bleeding visible beneath the skin is a blue or purple patch. And there's some really good examples of ecchymosis that you can see visible as a purple patch. These are actually, sometimes they get raccoon scars. That could indicate head trauma. If you get like battle scars or battle, I can't remember what they're called, or you get bruising back here. Yikes, there could be something wrong with your brain. Okay, next. Okay, there's no way there's an X. X, like woods cross. We don't need that. Okay, R. Oh, there's an R. So we have one R left. It's referred pain. So we're going to go there. So sometimes the injury is away from where you expect it to be. So for example, if someone gets kicked in the side, then you can actually hurt the kidney, and the kidney will actually refer pain to the lower back, even though the kidneys are up higher. So it's pain that occurs away from the injury site. So sometimes it makes people confused because they're like, well, if it's here, then why am I feeling it in a different area? It's referred pain. Okay, next letter. A. Oh, good. We haven't seen an A. Abrasion. So these are good ones, like baseball and softball players get these a lot. So if you slide into a base and maybe you're not completely covered with your uniform, you can end up with one of these. Just you're rubbing away the epidermis. If you're getting to blood supply, you're to the dermis. So you're just kind of rubbing into that second layer of the skin. That's an abrasion. So this guy's got some serious road rash. Maybe he dumped his bike or something. Okay. We're going to go with another A. So acclimatization. We had a brief talk about this. This is getting ready for an event. So for example, we had the Olympics here in Utah. So a lot of people were traveling either here or to Denver to get to a higher altitude so they could start to acclimatize to the area. So it's basically getting your body used to whatever the climate is in that particular area. Nailed it.
Happy slapping.
Okay. Up, 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 up. The letter E. Edema. So edema is swelling due to abnormal accumulation of fluid in tissues or cavities. So, yeah, if we get swelling of the feet like this, that would be edema. You can see it in diabetics a lot. We used to be next to the wound care clinic, LDS. There's some gnarly things that go through there. Okay, keeping on going. All right. So letter C. Or C. Okay. Letter C. Cartilage. Okay, this is gristle-like padding that lies on or in between bones. So we have cartilage. That's costal cartilage. So remember we talked about putting leads on, or when I would put leads on at the hospital, we go to the fourth intercostal space. You're actually palpating the cartilage, maybe a little bit of rib when you do that, to find where you put those leads. So that's the chest cartilage there, costal cartilage, or in between the ribs cartilage. That's what costal refers to. The symphysis pubis, or the pubis symphysis, is the cartilage that brings the two pelvic bones together. So you can see that cartilage is just kind of in a lot of different places between our bones. Okie doke. And then I want it to be an F. A V for Viewmont Vikings. So actually we're going to go to Varus on this one. So, okay, the definition here is telling you to look at the distal aspect. So if you're talking about the distal aspect, that it's going to be the ugly date. The ugly date is the foot. And in this case, the foot is actually pointing inward. Okay, so toward the midline. But if you look at the knee, so this is why a lot of times people get this confused, is because they're like, wait, the distal aspect. So knees go out, foot goes in, or knees go in, foot goes out, if that makes sense. So if you look at the way this guy's standing, it's bow-legged is a lot of times what people call it. That's a varus deviation, where the knees are out, putting pressure on which ligament, and then we end up with the feet coming in. So that's varus, and I see it as like more air between the knees. Okay, we're gonna keep on going. Come on, F. L. Oh, this might be a good one. Laceration. Yep, look at that. Okay, a jagged cut or tear in the skin. This is like Harry Potter's lightning bolt. That gnarly one in the right bottom corner, if you ever get a chance to see like the gnarliest soccer injury, that was it. That one was so ugly. If you look at the top left picture where that guy's bleeding pretty bad from his head, remember we've got some superficial blood vessels. They're real easy to tap into, and they're pretty good bleeders when you get them. So that doesn't necessarily indicate that he's, I mean, he could be, but it doesn't necessarily indicate that it's too terrible. Okay, so laceration. I just want you to take all that in. That looks good. And then back. Ooh, we skipped one. We're just going to go to that one so I don't forget. So ligament. There's ligament. It just connects bone to bone. So if there's a sprain, that's ligament. If it's a strain, what's that? Good question. Okay, we're just gonna do like 2 more today, and then I might kind of leave this out there for you so you guys can find the rest, or maybe we'll go 1 more and then I don't know. This is good fun times. Okay, B for bursa. Remember we had the subacromial bursa? Remember that? It was this right up in here. Okay, it's a fluid-filled sac at a joint that prevents friction. So here's the subacromial bursa. I'm pointing at it with the mouse and you probably can't even see it. Okay, the bursa is underneath the acromion. That's the tip of the shoulder. You've got bursa in the knee. So remember, if you get, I think this is the next one. I'll just go to the next one. If you get inflammation of the bursa, you get bursitis. So in this, if you've ever seen an elbow like that one on the far right, I used to have a student that had that problem. So she had some pretty bad bursitis, and it would tweak your elbows out like that. Okay, smoky, 1 more. We're going to get one more, honeys, and it is a D for dilation. Okay, so it's a state of being enlarged. So I like this one because it's showing you, like, here is on the top left, sort of, well, there's the body thing and then the vessels. What they're showing you is someone that was like Netflix and chips for way too long, and then they got this plaque on the inside of their artery, and that started to narrow the vessel, and they probably did a calcium test to determine, like, oh, we've got some calcification in the blood vessels, so probably risk for heart problems. And so they'll put in a catheter, which is what they're showing you in those subsequent pictures, and they're gonna put a balloon in there and break up that plaque when they stick that inflated balloon in. So, and what that does is it acts to dilate the vessel. So that's also giving you the dilation of the pupil example. Another example is if a person is having, say, an asthma attack in your bronchi, so your bronchi are getting kind of closed off. When a person uses an inhaler, when they do that kind of a thing, it is actually a steroid that is a bronchodilator. So it will actually work to expand out the bronchi. So that was the other example. Okay. I think I said that was the last one, but I'm going to just say, I'm going to pretend like I got a G. I had a G, so since there are no G's, I'm going to the F's because I wanted to hit F's today. So here we go. Fracture. This is a break or crack in the bone. Any break or crack in the bone. So now I'm going to give you a look at these different examples, starting top left. You could have this from spearing. There's a reason why in football they've changed the rules a lot, and they used to have helmet-to-helmet contact like this. When that happened, you had the force coming from the top of each one of their head going back through their body and kind of against the ground because their feet are on the ground, and you compress the vertebrae. So that's a compression fracture. A depressed fracture is next. That's like if someone, just think kind of blunt force trauma there. Green stick fracture is when, if you look at that bone, it's kind of hanging on by a thread, and so they liken it to if you take a dead branch and you go, it breaks all the way through. But if you take kind of a green branch and you try to break it, it doesn't go all the way through usually, or not easily. So that's a green stick fracture. Longitudinal can come from twisting action sometimes, so it can be a spiral fracture too. So landing bad there, but it goes along the length of the shaft of the bone. And then you've got simple, which means it didn't break through the skin. Compound, like Kevin Ware's, was the one that went through the skin. So impacted is where it's hitting against bone on bone, spiral, transverse, oblique. So it's showing you that all on the humerus there in the bottom right. And then you've got, looks like you got, the radius is broken there. So you've got a complete comminuted, and comminuted usually indicates the smashing kind of injury. So like picture someone's foot getting run over or something like that. So this is continued, more fractures to come. So this is a compound fracture sticking out. Sorry if that was disturbing. I should have been like disturbing content. This is a boxer's fracture. So remember we talked about, here's that money knuckle, the MP or MCP joint, and here's when they kind of crash against it, and these two bones give. So this is 4 and 5 metacarpal is what we're looking at. And then, whoopsie, his foot's on sideways. And then this arm, clearly it's not supposed to be shaped like an S. So continue, there's more. So more disturbing images. That football player, probably broken, but probably lots of soft tissue happening. Yikes there. And then that soccer guy's foot is wrapped around that guy's leg. That's good. Foot on sideways. Good sport injuries. So that's a good place for us to end. Okay, let me know if things aren't working. Let me know how you're doing. So in the assignments, I'm going to try to include a little question like, how are you? Just because I want to touch base with you I'm including it in the points because it really like helps me to know you're good. Okay, so we'll see you next time.